Welcome to our audience members here at the Iowa City Public Library, as well as those of you watching live stream on the library's YouTube channel. Special appreciation goes out to our co-sponsors, the Iowa City Public Library, Johnson County Interfaith Coalition, Immigrant Welcome Network of Johnson County, Center for Worker Justice of Eastern Iowa, Delta Sigma Theta, and TRAIL, and the acronym for TRAIL is Tools and Resources for Active Independent Living. Now I'll go ahead and I will introduce our two speakers. I'll start with Jennie Schmidt. Jennie is the Executive Director of the Free Medical and Dental Clinic of Iowa City. She has a doctorate degree in education with her emphasis in social foundations of education from the University of Iowa. Her bachelor's degree is in philosophy, and that's from Earlham College. Prior to her current position, she taught at Mount Mercy University in the education program. Jennie has been the executive director of the clinic since 2022. The Iowa City Free Medical and Dental Clinic is a nonprofit organization that was established in 1971. They provide medical and dental services to people in Iowa City and our surrounding community who wouldn't otherwise have access to care. This is one of the first and oldest free medical clinics in the nation. Bram Elias is a clinical professor of law at the University of Iowa. Bram received his bachelor's degree from the University of Michigan in political science and English. He has a master's degree in comparative ethnic conflict from the School of Politics, Queen's University of Belfast, and this was on a Fulbright scholarship. He has a master's of public policy from Harvard's Kennedy School of Government, and his Juris Doctorate is from Yale Law School. Before joining the clinic at the University of Iowa, he worked in private practice as an immigration attorney, and he mentioned that his office was above Java House here, just around the corner. He has directed the clinic's immigration practice since 2015. His students represent clients in immigration proceedings, and they also work with organizational clients who are engaged in advocacy related to immigration law and policy. Before the panelists begin, I want to remind you to compose your questions that you want to have answered after their presentations. We'll entertain questions from the audience here at the public library, and we'll also take questions from those of you watching remotely. If you are live streaming, please put your questions in the chat. We're watching for them, and they will also be included. Thank you. Now, I'll turn it over to our panelists. Thank you, Jennie.
Hi, can you hear me okay? Okay, great. I'm just going to pull up some slides that will help me remember what I'm hoping to speak with you about, and we'll get going. So thank you for that nice introduction, and so great. I know Bram just from the work we're doing, but I didn't know all this about you, so now I have more questions, and we were probably in Cambridge at the same time. I used to teach at the King Open School down in Central Square. So, yeah, worked with Bob Moses and such. So, all right. So I am with the Iowa City Free Medical and Dental Clinic, and we have been in the Iowa City area since 1971. We're thought to be the second oldest continuously running free clinic in the United States, which we're really very proud of. And we like to situate that in Johnson County and Iowa City just as a place that has a long history of caring and taking care of each other. So we are very proud of that. I'm going to talk to you a little bit about what the clinic does. I know some of you have heard me talk about this before, but in case you don't know, and then I'm going to situate our work just in terms of like the immigrant experience in Johnson County, and then Bram will follow up with more details about the law. Our mission is pretty simple: to provide quality, comprehensive health care services for the uninsured and underinsured in Johnson County and surrounding areas. Our principles of practice are to eliminate barriers to health care by offering services without cost, to offer services that are non-judgmental and confidential, to encourage the participation of patients in their own care, and to advocate for the medically underserved in our community. So I like to often say we work our hardest to put the care in health care. And I recognize that our patients have access to often much better care than I have access to. I shouldn't say. No, very have access to care. We were established on the idea that access to health care is a basic human necessity, a right. And in 1971, successful, they moved to the basement of the Well Center, where they were until 2006. And then we relocated over on Towncrest behind CVS on Muscatine. We've been there since 2006. We are outgrowing that, and so we are right in the middle of a major renovation while continuously operating. And we are adding on exam rooms. We're doubling the size of our dispensary, the lab, making 2 ADA bathrooms, an ADA stairwell, and other things that will allow us to increase the capacity, because unfortunately, the demand hasn't gone away. It has over the years, but it hasn't gone away. And so that's where we are, and a little bit of who we are. We see the uninsured, those who are unable to afford insurance without, even with subsidies. So most of our patients work and are employed. Some are in low-wage jobs that do not offer insurance. Many are in low-wage jobs or jobs, medium-wage jobs that offer insurance that's prohibitive to them, as it would, and I see heads nodding, it'll eat the whole paycheck. Increasingly, we're seeing people who we would call underinsured, so they have the insurance, but the copay is beyond, what they can afford to pay. Increasingly, we're seeing people walk in and saying, I have insurance, but I need this medication and I don't have any money. So those kinds of things. Sometimes we see people between insurance plans if they lose a job. We see a lot of people who are like 26 to 28 when they're figuring out they're no longer on their parents' insurance and trying to figure that out, and many who are in the process of getting insurance. But for the most part, we are seeing the uninsured, and as I'll talk about later, many of our patients don't have access to insurance that they can afford, and don't have access to any of the other entryways into insurance, into medical help like Medicaid or Medicare or CHIP. Most of our patients have not seen a physician in a very long time, because for most of them, this is not the first time they haven't had insurance. Maybe they've had a whole lifetime without access to health care. For those who are immigrants, often the journey of immigration keeps them from getting those routine checkups and physicals or continuations of medicines or any access to care. And so by the time they get to us, many of them are presenting with multiple and increasingly complex medical needs. So many of our patients have chronic diseases, and often we're seeing not just diabetes, but diabetes that's been undetected and untreated. So it's morphing into a whole new layer or level of disease. And I always like to talk about when I talk about the clinic in Iowa City and Johnson County, and these are our community members who we're seeing. I'm not going to rattle off too many statistics, but what we're seeing, we've got about 6,700 clinic visits in the course of a year, during which 14,720 diagnoses are treated. So you can see numerically, nobody's coming in with a thing. It's many, many, many things with many, many, many visits. Most are uninsured. Most are from Johnson County, with about half from Iowa City. Most are reporting below the federal poverty line, and then the remainder almost exclusively between 100 and 200% of the federal poverty line. And most of our patients right now self-report as Hispanic or Latino. We do not, for the most part, we do not see children. They're seen by Healthy Kids in the schools, which is kind of our sister organization doing the same thing. Marguerite Oding, as I see heads nodding. We do host Healthy Kids pediatric dental clinics, and we offer lab services to Healthy Kids. And starting this year, Iowa City Public Schools changed the rules so that it used to be that they could see anyone from Johnson County, but now the children they see have to be enrolled in Iowa City Public Schools. So once a month we host, like we open our doors and Marguerite comes in with a team and they see there's about 30 kids out in Tiffin who otherwise wouldn't have access. So we work really closely with them. But other than that, we don't really see children. We offer acute care. We do case management for this large portion of our patients living with chronic disease, specialty care, and dental. At the clinic, we also offer interpreted services. We use volunteer interpreters, which we always are looking for more if you might be one or know one. And then when we can't do it that way, we've got access to an online app with live people. You know, we call up and we can get some interpretation that way. We have a lab and a medication dispensary. So patients come, they see their doctor, they get their labs, they go home with their meds. They need, if they're a diabetic, they get their insulin, their syringes, their glucose monitor, their monitoring strips, all the things they need to deal with their disease. We also offer diabetic education and support. We are an HIV STI testing site for Johnson County, and that actually, I like to point out, that kind of accounts for like the 1.5% of insured people that we see, is because we are a testing site for STIs and HIV. And this year we added, once Mercy closed and we need to interface with UI Healthcare more, we have added a patient navigator who's helping our patients with their patient financial assistance papers. And then offsite, we offer mammograms in partnership with Team Breast Friends. So anybody who does the Team Breast Friends walk or donates to them, you're helping us too. And corridor radiology, which has given us a good price to get our patients over there. And then we also have vouchers for eye exams and glasses, thanks to Iowa City Lions, hearing aids, and medications we don't carry on site. We can offer a voucher, and we have partnerships with arrangements with Walmart and Hy-Vee, where the patient can give them a voucher and then they invoice us. We have 2 part-time doctors, 2 part-time nurses, 2 full-time nurses, a part-time RN, a part-time LPN, and 1 part-time patient navigator. And the rest of the service is provided by volunteers. And volunteers are everything from interpreter to reception during a clinic to clinic assistants. We still have paper files. We are working towards going electronic. So anybody who wants to help when we get into that, there's going to be a lot of scanning that has to happen. But so now we have people who come in and they just pull the paper files and help us get ready for the next clinic or put the files away. So we really rely on volunteers. And there's a piece of paper in the back. I silly did not bring like my formal materials, but I do have my card and a sheet if you want more information. Or you can go to freemedicalclinic.org, and in the upper right-hand corner, there's a button to find out more about that. I talked to you about how much we've offered. I mostly just want to point out it's growing year over year over year. And yes, we're living in fear of any changes to Medicaid because we cannot keep up with the demand that we're seeking. We're already booking medical appointments into July. And so in general, there's not enough, there's just the demand is overwhelming. Medically, and then in dental, it's overwhelming times 10. We've just started tracking who's coming in and whether or not we're able to help them and send them away because, you know, we're doing an assessment. So a needs assessment, and I'd say about 40% of the list are people calling or coming in with dental needs. So that's a little bit about what we do. And now I'm going to talk a little bit about what we do in the context of serving immigrant and refugee populations here in Johnson County. So when we talk about immigrants, and I just want to talk about like what are we talking about. So we have the recent Census Bureau says there's about 47.8 million foreign-born folks in the United States, which is 13.4% of the population. and that 48% of that population are non-citizens. So always difficult to talk about non-citizens, people without legal status. Sometimes people say undocumented, but people who don't, who are not citizens, and then from that group that's not citizens, you then have other subgroups. Pew Research estimates that there's about 10.5 million immigrants without legal status. And many immigration categories, so not all immigrants are, there's no such thing as an immigrant, especially when it comes to accessing public services. So the differences between migrants, refugees, asylum seekers, that's just a few. I thought about really summarizing them, but there's like 25 or 26, so I'm like, really key is whatever category you're in either leaves you as qualified or unqualified to get the services. So the patients that we're seeing, well, I don't know what their citizenship status is because we don't ask. But, thank you. But presumably, one could infer there's a great chance that they can't get Medicaid because they're unqualified, and I'll talk a little bit more about that. For Johnson County, the most recent Census Bureau estimates that 11.6% of Johnson County is foreign-born. And again, when we talk about, like, there's no such thing as an immigrant, like, my doctor is from Southeast Asia, and she's an immigrant, and the person, coming into the clinic who doesn't have health insurance is also an immigrant. People are here for different reasons. In 2022-23, Johnson County did their community health assessment, and of their key findings, they found a very urgent need to address healthcare inequities and improve the overall health and well-being of Johnson County. That's their number one priority. That there's an unequal distribution of quality, affordable healthcare, including significant disparities along racial and ethnic lines. Kind of two Johnson counties, right? There's been some conversations in Lynn County. They have a federally qualified health center. Could we get one in Johnson County? And there's a lot to it, but just sort of like for some of us in Johnson County, we're in a healthcare oasis, right? And for others, we're in a desert. And so that's one of the dynamics we're dealing with. So this unequal distribution. There are fewer of the uninsured people, uninsured members of Johnson County. There's a disproportionate number within the Hispanic community that do not have, Hispanic Latino community that do not have insurance. And despite being one of the wealthier counties in Iowa, Johnson County has a Gini coefficient higher than the national average, which is an indicator of how evenly the income is distributed. So we have a lot of income inequality, as you can observe, I'm sure. This is kind of interesting in looking at tonight. I'm like, well, what do we know about immigrants and healthcare? And so a study in JAMA in 2020 said that, and this is why it's a little hard to talk about too clearly, is most studies of the uninsured don't track immigration status, so we're kind of inferring from different data points. A Kaiser Family Foundation 2023 study showed that immigrants are disproportionately uninsured compared to U.S. born, regardless of immigration status. So even among those who have legal status, they're seeing a disproportionate level of being uninsured. Unauthorized immigrants had less use than authorized, right? And authorized immigrants, which I'll get into in a little, they have access to like Medicaid and CHIP and Medicare. This was interesting to me. U.S. born population had the highest number of visits per person per expenditure, and that the longer immigrants stay in the United States, the sicker they get. So I thought that was really interesting. So, yeah. And again, we'll get into so a lot of this, and the slide is wonky, but what I care about is this. A lot of what I'm going to talk about that we're seeing with our immigrant and refugee populations is not differentiated from just the negative impacts of the social determinants of health. So if you are here as an immigrant, particularly if you are don't have legal status and you have limited access to high wage paying jobs, so you're working a low wage, tendencies are you're going to have lower education, lower access to education quality for your kids, low access to health care. You're going to have less desirable, you're going to have challenges in getting affordable housing that's safe and secure. You might live in more unsafe neighborhoods, and have more less economic stability. All of these directly negatively influence our health, right? So all of these things, you're in a food desert, you're working long hours, you're having trouble paying the bills, etc. Your stress levels are going to rise up. You're more likely to eat food that's conducive to chronic disease like diabetes and hypertension, and all those things that are highly correlated in any population with low health outcomes. And so other factors that negatively influence immigrant health is lack of prior access to health care, including immunizations and routine preventative care. We have a disproportionately high level of positive, I'm not a medical doctor, like when we do pap smears, we do cervical cancer screenings, our rates of problematic returns are much higher because people not born in the United States are highly unlikely to have had an HPV vaccine. So this is one of the things that we're dealing with a lot and trying to get access to take care of that. Also, all of this stress, including for many, the traumas that push them to migrate, have left the population with high levels of PTSD or mental health challenges. And again, we also have a mental health access crisis in the United States in Johnson County. So we see those things also mixing in with those social determinants of health. The biggest barrier is cost and access. Like, are you able to go there and can you afford it? So many non-citizens are I kind of said this, like they're in low-wage occupations that may not offer insurance, or they offer the insurance, but it costs an arm and a leg. A friend of mine is married to a Guatemalan man, and his sister just migrated here with legal status through chain migration, and she very excitedly got a job at yeah, and she has health insurance for her and her daughter, and it's $1,000 a month. You know, and she's cleaning staff, so I don't know what she makes, but I can kind of figure out like that's pretty prohibitive. So that's really common anymore with the working poor. And also, as I've said already, without that legal status, which can come in many different forms, you are excluded from non-emergency Medicaid and other public support avenues. So, so federally funded health care, most immigrants are considered non-qualified for programs such as Medicaid, Medicare, and CHIP. And this came out of in 1996, the PRORA, that's how I say it, you know, I got a lawyer here, Act, which is, you know, I don't see this being repealed anytime soon. You know, in the past, we might say, write your senators and, you know, encourage them to repeal PRORA, but it doesn't, you know, that's, and so there is an exception of emergency Medicaid that states are required to provide limited Medicaid services for treatments in emergency medical conditions regardless of immigration status. So if you present at an emergency room with an emergent condition, you have to be treated. Now, one of the complications there is you might think you have an emergent condition, you know, and you don't, and so sometimes it can result in a bill. So that can often be a huge barrier, is just fear of this bill. Also, we've had patients who come in, they're like, I went to the emergency room and now I got this bill, and fast forward, we connect them with a social worker and we're able to do the paperwork and the bill gets dismissed, but that's a really unsettling feeling for anyone, especially if you don't speak English, you're not here with legal status, you know, you're very insecure. It's a really hard thing. And so then anecdotally, those stories can spread and people be like, don't go to the emergency room. They'll tell you it won't cost, but it will. So that's one of the things. Emergency Medicaid only needs to cover 2 months of pregnancy, even though you're pregnant for 9 months, and then you're postpartum for the rest of your life. And so the University of Iowa Family Medicine partnered with us, and for years, from 2017 until this summer, we hosted a clinic at a Thursday evening prenatal postpartum clinic for those 7 months of wraparound care. But a really good piece of news I like to spread is the University of Iowa changed its policy, and anyone who is pregnant, regardless of to get emergency Medicaid, you have to show you've been here 6 months. But the University of Iowa, if you're pregnant, come on in. And that program has moved back to UI hospitals and clinics, and they're seen within family medicine throughout their whole pregnancy and thereafter, which is great. And we hope that that continues. So what's left to be available? Federal qualified health centers like Cedar Rapids. And again, your legal status doesn't matter. You can get service there. It is a sliding scale, so it's not free. But for many, that can be an option. Especially now they have a 5-chair dental program up in Cedar Rapids, so we do end up referring a lot of people to Cedar Rapids for dental care. Hospital charity care, like I said, Iowa, UI hospitals, there is access for people at the hospital. There's a lengthy paperwork process that you need to go through, and that process could really be, it's overwhelming. If it's all in English, or if you have low literacy levels, it's even more overwhelming. And nowadays, it's just a lot to ask someone to trust. Like, you're going to show all these documents to an official U.S. organization, and it's going to be okay, you know. Yeah. And so that's something, you know, we're really fortunate. The Community Foundation of Johnson County gave us a grant to get a social worker to get a program started to help walk our patients through that. Nationwide, the Ryan White HIV/AIDS program has a long history of not asking about immigration, and then CDC prevention-funded programs, if they still exist, they fund preventive if it's a matter of public health. And again, I also feel like I have to say, like, anything I say tonight could change by tomorrow. We all know. But in the past, if it's a public health issue, then immigration status doesn't matter. So again, in partnership with Johnson County Public Health, we had COVID clinics up until August of this year when the CDC stopped funding COVID clinics. So, and then the other choice are free clinics, of which there are, you know, all throughout the United States, free and charitable clinics. We are one of the only ones in this area of Iowa. From here on east, there really aren't any. There's a few in Des Moines, Waterloo, Cedar Rapids has 2, so there are others, but then it kind of becomes from here to the river, there's just not that many options. We had a group up from Burlington the other day, and they're looking to start a free clinic there, but we have a lot of patients from Louisa, Muscatine, all the counties down in the southeast. Other barriers, some of these I've already mentioned, so I'll fly through this: fear, language literacy, transportation, geography. A lot of immigrants and migrants in Iowa, not so much Johnson County, live in very rural communities that have limited access to health care for all populations, and particularly uninsured. A lot of people have had past negative treatment, bias, racism, discrimination, and so even if they might have gotten some health care once, they might be really hesitant to go back. There's a lot of confusion about whether or not they're eligible. So like I said, with the emergency room, it can, you know, be like, can I go here or not? And then time. You know, if I think about it, whenever I go to the doctor, I just say, hey, I've got a doctor's appointment. I'll be in at 11, right? But if you're working a low-wage hourly job, you cannot do that. And so that's another huge barrier. And so we run some evening clinics. This is a struggle because it's like, for staff, evening clinics and weekend clinics are very stressful on families, and it's not a highly, you know, it's hard to keep good staff who are going to work these strange hours. But for patients, those can often be the more convenient times to come to the clinic. So we, you know, we try to offer different times, but that's definitely a barrier. So the fear, the immigration enforcement fears, discrimination, the bureaucracy, a lot of these, you know, they overlap. The shame, you know, for a lot of people is just, you know, they're not comfortable going and getting free services. And so, you know, that can be a barrier. Knowledge of the healthcare system, you know, a lot of times, you know, we've had people coming from certain parts of the world where, like, they don't know what it means to make an appointment, you know. So, like, I was in Costa Rica for a while in a rural area, and every few weeks a doctor would come. You know, there were no appointments, just sometime the doctor came, and then you'd go to the park and they'd see people at a picnic table, you know, which, you know, there's different examples. But another problem we've had is we've gone to all electronic prescriptions because we found we were giving our patients a prescription and saying, go get this filled if we didn't have it, right? And we finally figured out, like, they don't know what a you know, like, they didn't grow up with that. And so, we just went to all, and we just go to Walmart, give them your name, the meds will be there. And then public charge concerns, which Bram can probably talk about much better than me, but in Trump's first administration, there was what began to be perceived as like, if you partake in any public service, if you get anything like SNAP or CHIP or Medicaid, it's going to work against you when you go up for your immigration trial. And that's not really what the law said, but that's what it was perceived of saying, and it doesn't exist anymore, and it's still, people are afraid, like, I can't go to UIHC because it'll come against me, and that's really done a lot of damage. Because of course, if they're afraid and they don't access the care, everything just gets worse, and then you have a real, situation. And so other things that even once they're in the healthcare, having interpreters, availability and quality, we really struggle with this. We'd rather have a live in-person interpreter than on a tablet. But all of that is better than nothing. Communication and cultural sensitivity, lack of patient understanding of their health and suggested treatments, medication adherence and compliance. So we've had situations, a lot of our patients just for whatever reason, I just remember when I was little, like I had to take the pink medicine for 10 days, even when my sore throat was gone. Like you just knew, like, you have to do this, but we run up a lot of, I felt better, so I stopped taking it, kind of thing. Or we've had insulin-dependent diabetics who are like saving it. Like they're afraid, scarcity minds, like it's gonna run out, and we have to say, like, no, just come back. We'll give you more. You need to take this. Things like that can be real problems. Or again, if you're working in an hourly job, in a low-wage job, you might not have refrigeration for your insulin or time to step off the line to take your medicine and things like that. I kind of talked already about the understanding of the healthcare system and the use of pharmacy. So barriers in so many forms to get in, and then once you're in. And then the consequences are just really huge, and we see a lot. Like I said, we're seeing people who might have started with an acute problem that's just exacerbated, or a minor chronic problem. Diabetes is a big problem in and of itself, but then untreated diabetes is like a whole new disease. Mental health, increased reliance on emergency rooms. It ends up being, if you want to take the cost analysis perspective, it's very expensive to not offer people early preventative health care and vaccination. It leads to increased rates of hospitalizations and public health concerns. So again, if we were to face another pandemic type situation, we have a whole section of the population without access to vaccination or other forms, that's not good for any of us. And then we're going to do questions after Bram, so I'm going to take that off. And then I will say, shameless plug, we'd love to have you come volunteer or donate. And I can get you that information afterwards, or like I said, my card is in the back. And I look forward to your questions afterwards, and I'll leave it to Bram.
So your organization is in the hands of a good executive director when all of your medical files are still on paper, but she got the donation on a QR code. It's pretty good. Okay, so my name is Bram Elias. I'm a clinical professor of law over at the law school across the river. I run our clinic's immigration law practice area. I want to keep my comments as short as I can, which for a law professor is still long. But I want to be as short as I can because so much has been changing so quickly in immigration law and policy and politics that I figure the more time we have for questions and answers and whatever's on your mind right now is probably the best way to spend my time with you. So here's the little bit that I would like to do while I talk. One is explain just a little bit about what my clinic is and the services we provide. And then I warned Jenny that this would happen if she went first. and then I asked her to go first. The second part of my talk is called Jennie is Right. And there are two things in particular I want to talk about Jennie being right, which is why I wanted to keep these slides up here. One bit, let's see, where do we get to? This slide here. If I can go to making it a pretty picture. When Jennie talks about there being many immigration categories, gives 3 examples, and then points out that the real question in the Medicaid context is the difference between a qualified alien and an unqualified alien. That is a very good example of something very important, which I like to talk about, which is how complex the notion of immigration status is and how things do not translate. One of the things I'm going to say about this, and a reason that Jennie is right, is that the terms qualified alien and unqualified alien are in federal Medicaid law and federal welfare law. They are not in federal immigration law. And so those terms, which sound like immigration law terms, do not map onto a totally different set of definitions for categories of immigrants. So I want to talk about that a little bit and how important that concept is. I also want to talk about the very important word in the first line there of seeker, the difference between someone who has asylum and someone who is seeking asylum, and the role of administrative delay in immigration authorities determining what kind of status someone has and how long you can live in limbo not knowing your own status and the government not knowing your status. So that's one thing I want to talk about. Jennie is right about this. And then I also want to talk about Jennie mentioned fear and how fear is an obstacle for immigrants accessing medical care. I want to talk a little bit about how that is correct. Fear is also an obstacle to all sorts of access to community life and shared life for members of immigrant communities, and how hard it is to maintain community and avoid isolation. And I also want to talk about how fear has changed what it means to be an immigration lawyer right now, and what it means to be an immigration advocate or an ally right now. What we do when we are advocating for or allying with communities, what that means on like a daily practice level, feels very different right now than it did a few years ago, a decade ago, in large part because of fear, uncertainty, and confusion. So I want to talk about that too. But first, let me talk for a little bit about what my immigration clinic does. So I teach in the law school's clinical program. We are basically a small law firm inside the law school. So we have 5 professors who are sort of like the senior partners of a law firm. I specialize in immigration law, but we have other areas of law that we practice. We have a professor who specializes in criminal defense, a professor brand new who specializes in federal civil rights and bringing like federal lawsuits against the government or against organizations that are impinging on folks' civil rights. We have a technology law clinic. We have a nonprofit and organizations clinic. So 5 faculty members, and then we all have students who work sort of like associates, and it's a class, and they get academic credit for their work. But what we are doing is real, with real clients going into real courts and real agencies, and we really do win and we really do lose. And when we really win, people's lives really are improved. And when we really lose, our clients really are in real jeopardy and we really are consoling them. That's a different kind of stress for law students than the regular stress of law school, which is itself quite intense. The stress of like, if I do something wrong, bad things are going to happen in the world. That's a different kind of stress. It's also what life is like as a lawyer, so it's nice to have a chance to practice working with those feelings with support and guidance before you're doing it in the real world all by yourself. And on the flip side, the satisfactions of doing something well or getting a good outcome for your client or doing a really adept job of counseling someone through a difficult situation, it's a different kind of satisfaction than doing well on an exam. One of our jokes is no matter how hard you work on a final exam, it will never say thank you. But our clients will. So it's a great place in the law school. We have a lot of fun with our students. The students often come alive in clinic, folks who remember, like they knew why they wanted to be a lawyer. They go to law school and it's different from what they thought and they wonder what they're doing. And then they actually get to practice law for real and they are reminded, oh, this is why I was here. The helping people aspect of it is much more real. Very fun place to teach. If any of you, when you grow up, want to be clinical professors, I highly recommend it. Okay, so we're across the way. My students work exclusively in immigration law and immigration adjacent areas. So if we have community members who are If we're in defensive posture where the United States government is trying to remove our clients from the United States, they usually have to do that in front of a board or a forum called the Immigration Court, the Executive Office of Immigration Review. We are the equivalent of a defense attorney defending our clients against allegations that they have to leave the country, arguing there's reasons they get to stay. We are on one side of the case. There's usually a government attorney on the other side. It's in front of a person who is like a judge, called an immigration judge, judge-like function. So we do that. That's our defensive work. We also do affirmative work. That's where we're working with folks who are in the United States who would like to improve their status. They have none, and they would like some. They have one kind of status and would like to increase it to permanent resident status or green card status. They have green card status. They'd like to become a citizen. They're here and they'd like asylum or protection from return to their home country. If it's someone who is going affirmatively to the government and saying, please allow me to stay, or please give me this set of benefits, that's a different kind of work. We do it in front of a different agency, U.S. Citizenship and Immigration Services. Most of that work is in front of an adjudicator or a hearing officer. There's no government lawyer on the other side, but you're still lawyering for your client through that process. So we do that too. So we're defending immigrants who are here in the community. Government's trying to remove them. We're trying to help them stay. We represent immigrants who are already here and trying to figure out a way to improve their status or to bring family members over to join them here. And then sort of the third leg of what we do is community work, partnering with community organizations who serve the same populations that we serve directly. So we learned that one way we can help our clients, and one thing that I really like training students to do if they're going to be helping clients like this over the course of their career, is to realize in addition to helping one person at a time, which is wonderful and satisfying, you can also work with other organizations that can sort of like lift the floor for living experiences for the folks you're working with, and get a lot done that way that helps your individual clients a lot. So we partner with folks like the Free Clinic, the Healthy Kids Clinic, the Eastern Iowa Center for Worker Justice. We've done some work with the school district. Lots of places where our clients and people like our clients are getting services. If my students can help make those organizations bigger, stronger, more capacious, that's helping our clients and other folks in our client situation, which is, it's neat teaching young lawyers that that's a thing they can do with their career, and it's a lot of fun too. What we do for organizations like that changes with the times. Right now, we're doing a lot of know your rights style training. The request we're getting from the community is, what happens if there's an ICE raid? You know, what are my rights? What can we do? So we've been meeting with, we get the questions from organizations, we go do the research, we come back and tell them, like, here's what the law says you can do, here's what policy says you can do. In past years, the requests have been different. We teamed up with the public school system in West Liberty, which is a majority-minority city down south of Iowa City, southwest, and the public school system there is majority Spanish-speaking. We partnered with them to help with a mass naturalization program. So parents of children in the school district there who had green cards and wanted to become citizens but needed help with the naturalization test, we would go down and do meetings with 50 people at a time and train folks for the test, and really fun stuff. Years before that, we've done stuff working with organizations to build local policies. Another program at the law school working with some of my students helped start the community ID program at the county level, which worked with a lot of folks in our community. So we do organizational work and community work, which is a lot of fun. Okay, that's what we do. The way we get our clients, we are one of the only free legal providers. There's only 3 free immigration law providers in the state of Iowa. We are free. Drake has a law clinic in Des Moines that is free, and there's a statewide nonprofit based in Des Moines called Iowa Migrant Movement for Justice, which is almost free. They have a couple of things where they have to charge fees, but they're mostly free. So we have lots of folks looking for our services. When we can help people, if the case that is brought to us is a good teaching mechanism, includes the sort of legal issues my students should be working on, includes the type of clients where it's a good learning experience for my students, that's usually a pretty good fit for us. If it's a client who's connected with some of the community organizations around Iowa City, where helping one client might get the word out in the community that if you go to the free clinic, not only can you get good medical care, but I got a referral that led to me getting a green card, maybe my friend should go to the free clinic too, and that leads to people getting better medical outcomes. That seems like a really great use of our limited docket space to take on one client. So if there's ways we can use our docket space to assist local organizations, we take cases that way too. For the most part, we have a wait list that is 1 million miles long. So we are also very, very vigorous about referring folks who want to work with us, but we don't have space, to the most reputable private practitioners we can find, private or nonprofit practitioners. There's a good network of folks in Iowa City, Eastern Iowa. Des Moines has a really good set of folks. And when we can take folks and refer them out to other good service providers, we're always very happy to do that too. Even if we can't provide the service, just getting the information out there that there's other good, safe places to go feels like a good service. Okay, that's us. Can I talk for a little bit about two important ways Jennie is right? All right, so way number one. Jennie said on her slide, there are many immigration categories. She lists three, and that the big key is qualified aliens versus unqualified aliens. And as Jennie said, there's a lot of categories. There's a lot. And she is right. Figuring out if someone is a qualified alien or an unqualified alien, not our choice of words. If it was up to us, we would probably not say alien, but federal statutes do say that, so that's what we've got. Difference between a qualified alien versus unqualified alien. Well, let's talk about the different categories there are. Immigration status. Lots of different kinds of immigration statuses. Most, but not all of them, are set forth in the federal code. The part of the federal code they're in, just to be a law professor for a moment, is Title 8 of the U.S. Code, Chapter 14, Section 1101, Part A, Subsection 15, subsections A through V, and Subsection 27, subsections A through M. As I'm sure you were doing that math quickly in your head, A through V is 22 different types of immigration status, and the next part, A through M, are 13 more different types of immigration status. So that is 35 different types of immigration status defined in federal statute, in addition to a number of types of status that are not established through statute, but are established through case law and international law and customary law. So there are more than 35 different types of immigration status. In those 35 that are explicitly defined in statute, more than 35 in real life. Of the explicitly defined 35 types of status, one thing that is not defined is the term qualified alien. That definition, instead, is in a different part of the code, not in Section 1101, which is definitions for immigration law, but in Section 1641, in a chapter titled Restricting Welfare and Public Benefits for Aliens. It's welfare code, it's welfare law. It's about immigrants, it's about non-citizens, it's about aliens, but it's in a part of the code that is for welfare law, not for immigration law. All right, Section 1641, which defines qualified aliens, Jennie, I think you might have got the math exactly right. That is divided into, let's see, I have it here, 16 separate legal categories. 16 ways to be a qualified alien. Of those 16, some explicitly reference some of the 35 in the other part of the law. When that happens, that's great, because you can say, it says here in the code that I'm this kind of person gets it. It says here in the other part of the code that I am that kind of person, so I have to dig up two separate pieces of law, but I add them together, and I can establish very clearly I'm entitled, I'm a qualified alien. But most of the 16 use their own language from the welfare code, do not reference anything in the immigration law, and use different terms. So lawyers who, someone will go to an immigration lawyer and say, hey, is my person a qualified alien? The issue is, do they have this type of medical situation? I'm like, I don't know, let me go look up my 35 types of status defined in Section 1101 that I deal with every day. I don't see it, I don't know. When you are an applicant for Medicaid, Medicaid will look at you and be like, how do you not know your own immigration status? How hard is it? Are you qualified or not? And in fact, what we've got is, if you think immigrants have a hard time navigating government systems because of language barriers, I assure you, those administering government systems also have language barrier problems because it's hard to speak Chapter 1101 when you actually are more fluent in Chapter 1641, and they don't use the same terms. Okay, so one thing is oh boy, it's hard to figure out because some of them don't fit there. Oh, but it's more complex than that. Here's some other ways it's complicated. Raise your hand if you have heard of DACA. Good. Those watching at home on the internet, I can see you and you're raising your hand. So thank you for being well educated. Or you're Googling it right now while you listen to, you are multitasking just like my students do when I teach on Zoom, and you're looking up DACA right now. Deferred action for childhood arrivals, a special kind of semi-status, immigration status that has been in place since the Obama administration for immigrants who came here as children. and fit all sorts of other criteria, and you are able to apply for this kind of status, and if you fit the criteria, you are established as a DACA recipient, and you get all sorts of benefits, including, once upon a time, clearly, eligibility for Medicaid. Lots of lawsuits about DACA. It was there, it was taking new applicants, there was a judge who said it shouldn't be there, that judge then got overruled, it was back again, there was a president who took it away, a judge said the way the president took it away was illegal, so it was back again. Lots of moving parts about DACA. Right now, you cannot apply for DACA if you don't have it. People who, no new applications being taken, put on hold by a judge in Texas, but people who have DACA can't have it taken away while the judge continues to hear that case. That case has been going on for over a decade, so no one thinks it's going anywhere anytime soon. But there are lots and lots of people across the country with DACA status. Okay, if you have DACA, are you, with this very interesting federal program subject to lots of lawsuits and lots of judges weighing in on what it does mean and what it doesn't mean? If you have DACA, are you a qualified immigrant? What an interesting question. The answer is, in 20 states, no. In 30 states, yes. Because 20 states joined a lawsuit saying, we think that DACA is a real problem, and we think that it's bad for our state resources for folks with DACA to receive Medicaid under state funds, and a judge in that case said, I think you are right, but only 20 states signed on to the lawsuit, so this will apply in 20 states. So if you live in one of those 20 states, including Iowa, and you have DACA, you are not a qualified immigrant. But if you live in one of the 30 states and you have DACA, then you are a qualified immigrant, or can be, depending on how long you've been here. Has nothing to do with you, just to do with whether your state attorney general decided to sign on to one of the many DACA lawsuits. If you hear someone suggest, how does a person not know their own status? There's one way. I guess if they're keeping up with federal litigation, they might. Okay, so DACA, maybe you are, maybe not. But I think there's an even more important exception, which gets to both the way Jennie is right about this, and why fear and confusion is important. And that's where she mentions migrants, refugees, and asylum seekers. So I mentioned there are 35 different kinds of immigration status under the statute. One of those is refugee. Another similar one is asylee. Refugees are folks where it's not safe for them to return to their home country because of a specified reason. There's limited reasons under law that count. If you're afraid for one reason, you can be a refugee. If you're afraid for a different reason, you're not. Folks who meet the legal test for being a refugee, they are afraid of being returned to their home country where they will face persecution on account of their race, political opinion, religion, nationality, or membership in a social group which in their home country is like one of those other four groups, a sufficiently distinct group that it's almost like a race or like a religion in their home country. If you will be persecuted on one of those 5 grounds and a judge overseas, some adjudicator like the United Nations, decides, yeah, boy, it's not safe for you to return to your home country, overseas you are adjudicated as a refugee and then eventually resettled. And if you are resettled into the United States, you arrive with the legal status of refugee. Adjudicated abroad, come to the United States lawfully as a resettled refugee. Asylee, exact same legal test, it's just the adjudication is done here in the United States. The place where you ask is you're here in the US. Either you cross the border or arrive at the border and say, I'm afraid to go home, please give me asylum status, or you enter lawfully, you're here on a student visa or a tourist visa, and while you are here lawfully in the United States, you go to the government and say it's not safe for me to go home, or you enter unlawfully, make it into the United States, and then if they try and remove you, you say, wait, before you send me home, you should know I will be persecuted, and I'm legally entitled to stay here. If it happens here in the United States, asylum. If it happens abroad, refugee, same legal test. Okay, so great. If you are an asylee or a refugee, you are entitled to lots of benefits. Medicaid is one, but there's lots of other ones, right? If you're not, then not. Not that complicated. Guess how long it is taking right now for my clients from when they apply for asylum, which is something we do in the clinic a lot, until we get a final adjudication of whether you receive asylum or not. How long that is taking. 5 years. 5 years would be crazy, right? That would be crazy, but it's actually 16. It can vary. You can get a yes sooner. 16 is sort of like if you get a no at the first level, which takes between about 6 months to 6 years. And if you get a yes at the second level, that takes between 4 and 10 years. It's going up. The delay is going up. Okay. During those 16 years, I can assure you, as an immigration lawyer, you are lawfully present in the United States. You are doing what you are supposed to do. You have reported yourself to immigration authorities. You have provided your information. You are in contact with if they need to find you, they know where to find you. You are filling out forms. You are turning in fingerprints. You are going to interviews when you ask. You are being given a card in the mail that says you're authorized to work lawfully. You are not a qualified immigrant yet. You might be 16 years down the road. But for those 16 years, are you an asylee? I mean, you're not an asylee yet, but you're not undocumented. You're just waiting to find out which one of these things you're in. And that period of indeterminacy, that is large in all kinds of immigration law and growing all the time. People who are applying for green cards, one thing the current administration has taken the bureaucrats, like the adjudicators who determine whether someone gets a green card or not, pulled them off the work of deciding yes or no on green cards and redirected them to deciding at the border should people enter the United States or not. Whether that's speeding things up at the border or not, I don't know. But one thing we know is happening is it is delaying how long it takes to get a green card. I have clients who applied for something called a U visa. That is a special kind of access to the United States. It's subpart U of the statute, which is why I call it a U visa, where you are the victim of a crime in the United States. You are willing to testify about or assist law enforcement in the prosecution of that crime. And as a reward for helping American law enforcement, you are given eligibility for a green card through this U visa program. We have clients who are waiting 12 to 14 years to have their U visas adjudicated. And it's not because the government doesn't know if they're going to get it or not. In the case of U visas, it's because there is a statutory cap on how many U visa-based green cards can be issued each year. So the government will say to my clients, I have read your application, you win. But because of the statutory cap, it's going to be another 11 years before there's an actual green card available for you. So don't worry, you are here lawfully. I'll give you a authorization to work, but you will not fit one of the categories for qualified immigrant because U visa applicant is not one of them. You are merely a seeker. And something that is happening right now in all parts of lawful immigration is the period that people are seekers is growing. Ask a seeker what their status is. Ask an immigration lawyer what a seeker's status is, and it's not an easy thing to answer. And it's not just Medicaid that has a hard time deciding if folks in these indeterminate statuses are entitled to the benefit of Medicaid. It's driver's licenses, it's employers, it's banks, it's student loans, it is like higher education, what's in-state, what's out-of-state, loads and loads of benefits, public benefits, not even like benefits like welfare, benefits like just ways of living in society. When folks are in indeterminate status, it's very, very hard to navigate society, even if people are trying to help them, because no one can quite figure out what you are. And the current administration is doing a very effective job of keeping people in indeterminate status longer, uncertain longer. Okay, last thing I want to talk about before we do questions. Jennie mentioned how important fear is as a barrier for being integrated into society, being made to feel isolated, all sorts of fears. One thing she mentioned was public charge concerns. Public charge is an illustration of a very, very difficult dynamic from the last Trump administration, and there's a similar but different dynamic in the current Trump administration. Here's what public charge was. Last Trump administration, early in the 4 years of his presidency, there was a big announcement that a new program called the Public Charge Doctrine was going to be applied, and if the announcement was, if immigrants used public benefits that made it look like they would become, in the long term in the United States, a public charge, someone who is so poor they would have to rely on the public charity, the government, financially to get by. If you used a benefit that looked like you might be a public charge, you would be deported from the United States or not get lawful status or something. The press release was very vague. In English language media, the story was almost impossible to cover because what counted as public charge was hard to explain. In Spanish language media, it caught on like wildfire. Hey, did everybody hear if you apply for benefits or do anything that requires applying for benefits, you might be deported? That was never true. Never true. From the beginning of the program, the statutory basis for public charge applied only to a very narrow group of folks. People who would be applying for green cards would not apply to people who already had green cards, would not apply to people who are undocumented, would not apply to people who had like short-term visas, to student visas, tourist visas, nothing to do with folks like that. And the type of programs that counted as public charge like related programs was incredibly small. And even when they applied, all that meant was if that person ever applied for a green card, when that application was being processed, one thing the hearing officer would have to think about is, does this person's financial status now outweigh the fact that once upon a time they took this narrowly defined set of public benefits? It applied to very few people, and it applied to very few programs, and even when it applied, it did very little. But that didn't matter, because for 3 years, people were terrified to take any benefit at all because they had heard this might lead to folks being deported. One was they're afraid to take free medical services, so they're getting sicker. The one which I found most distressing was talking to friends of ours who worked in the public school system who talked about US citizen children of mixed status families. So maybe someone in the family had one kind of legal status, maybe one person had another, maybe someone was undocumented, maybe someone had one of these, seeker-style statuses. US citizen kids, born here, 100% right to be here, refusing to eat free and reduced lunches because the misunderstanding that was very much allowed to stand by the federal government was that if I take this benefit, then mom will be deported. Never within a million miles of true. That didn't stop people from not eating the sandwiches. And there was this fear that was not necessarily based in law, but it was very hard for local immigration lawyers to run around and be like, wait, the public charge is it's actually, do you have 45 minutes to sit down and I can explain this story to you, and I'll show you the 35 different statuses, and then you get, you read or you watch the news on Univision and it's like, careful, mom might get deported. It was fighting upstream about that, and it had major real life effects, even though there was almost never any legal effect at all. It was the fear about what might happen and the confusion and the misinformation. That was then. We have a different kind of fear and confusion and misinformation now. There is still the possibility of announcement of gigantic programs making everybody afraid, and then they never come to pass, but the fear remains. We have seen some of that. You might remember it was only 2 months ago, but it's going to feel like 10 years ago. Remember the threat that there would be no more birthright citizenship? Ages ago, right? We were so young, baseball season hadn't started. So that was an example of scary thing, kids born here won't be citizens. And that was stopped by a judge immediately, and no one ever talked about it ever again, but it's still out there, is birthright citizenship a real thing? High-level ICE raids, we were very worried early in the administration. Will there be stormtrooper-style raids in community? And I'm still worried about it, and we're still training people about what to do in the event of that happening. But the fear of the Trump announcements, the first week of the administration, big raids in Chicago, they're televised. That has sort of died away. Statistics show that, that those sort of arrests are lower now than they were during the Biden administration. But those are examples of announcement, fear, doesn't actually happen in real life, but the fear remains, and that's still doing some of the work of making people afraid to participate in society. But there's other stuff happening now, which I think is more a different kind of fear. And the logic of the fear, far be it from me to actually call it terrorism, but it is the logic of terrorism, of we will do a small number of extremely terrifying things. They're highly visible, and everyone will wonder, could that be me? I couldn't call it terrorism. That would be, who am I to say so? Now, my wife is an immigration law professor who has written an article called Law as a Tool of Terror, so maybe she says. Me, I couldn't possibly say. Although I will tell you, she's very smart. But some examples of these things you may have seen very recently in the news, right? We saw the video of what looks like a woman being disappeared in Somerville, Massachusetts from Tufts. Lots of them are terrifying in different ways. The one that two events that have struck fear into the heart of immigration advocates. You've probably heard of Mahmoud Khalil, the student activist at Columbia, who was in lawful status and was arrested and detained, had done nothing to violate his status. The government is arguing that there is a legal theory that allows the Secretary of State to just cancel the status of any person on a student visa, if he had a green card, any person with a green card, if their presence is bad for foreign policy. That legal theory is dubious, to say the least, very untested. It has the law that the government is relying on to do that has never been used, has been very rarely used ever in American history, and certainly never used in any way even remotely like this. But putting to one side whether the government is right about its ability to use the law to cancel someone's green card in that way, One thing that happened in Mahmoud Khalil's case was that he was arrested first. The people who arrested him at the time he was arrested did not know that change in status had happened. He did not know that change in status. It's not clear that his status was canceled before he was arrested. It may have happened, like they may have arrested first, canceled status second. Well, that's pretty scary. If you can be following the law nonstop and then be put into detention, moved across the country, when you yourself, you, as far as you know, have never violated the law. And the reason your visa or your status is canceled is not because you broke the law. It is because you have done something the government doesn't like, and they argue they have a legal process that enables them to cancel your green card. But there is no accusation that he ever broke a law, ever. Similarly, there is, you may have seen the news about the folks sent to a prison in El Salvador, like mass flights down there. There is one person in prison in El Salvador whose immigration lawyer argued is there by what is a very egregious administrative mistake by the government, who had a form of status called temporary protected status that allows you to be protected from one country. If you are from a country and there's a reason you can't go back there, and this guy had protected status from El Salvador. As his lawyer argued, there are 195 countries in the world. You could have lawfully sent him to 194 of them. And they sent him to the one place that the government cannot send him. And the government admits that in legal filings. They've said, yes, it was a mistake. Yes, he had lawful status. He's protected from return to El Salvador. But he's there now. And the government's argument in court right now is because he's there already, U.S. courts have no power to return him. And the U.S. government has no power to return him. It's out of our hands. Okay, that is almost certainly wrong. We will find out soon from a judge if that is in fact right or wrong. Probably wrong. Just like whether someone with a green card can be detained prior to their green card being revoked, almost certainly wrong. That doesn't mean they didn't do it anyway. Now, maybe they've only done it once. But there are a lot of folks out there with green cards right now wondering if they could be next. And if they go talk to their immigration lawyer and they say, hey, am I safe? 6 months ago, the answer would have been yes, definitely. And now the answer is yes, probably. Like, under the law, yes. Does that mean this won't happen? Probably not. And the government doesn't have to do things very many times for our answers to change from yes to probably. And that's a different kind of advice. And the other thing that's happening is what is going, like the rules in immigration law and policy are changing so fast, day to day. Jennie said, like, talking about, is there a CDC program? We didn't check the news to say if it's still there. Same feeling, like I'm very sorry, I haven't looked at the news since, about noon, because I was in meetings and then preparing for this. So there might be parts of immigration law that have changed a lot since the last time I checked. Okay, so the last bit I want to say, and then I want to stop for questions so we can chat with you a little bit, please. The last thing I want to say is the job of being an advocate and an ally is different in an era when the truth on the ground is changing very quickly or is unknowable. Because whether something is written down is not necessarily a good guide to what the government will actually do, or when the government is doing things very, very rarely, but very scary things that happen very rarely, and you can't promise folks that just because it appears to be illegal, it won't happen. In those circumstances, where information is uncertain and swiftly changing, where we are afraid and rightly confused, we can't give advice the way we used to, where we could say, if you do X, then Y. If you do A, then B. If you do not X, then not Y. If you do not A, then not B. If you do this, you are safe. If you do that, you are not. That's what we used to do. Now, the best we can do, not just as lawyers, but I think as advocates more broadly and as allies more broadly, is say, if you ask me a question right now, I can research the best answer to that question right now that will be as true as I can make it for you right now. But that might not be true in a week or a month or 6 months. So if you're looking for like long-term planning advice, you want to build your life around information, there's not so much I can do for, like I can tell you the right answer now, but with the caveat that it's just for now. Here's what I can do. Here's what we can do. Whenever you need an answer, call. I am there for you now. I will be there for you then. If things get hard in the future, you can trust me then too. One of the things that was on one of Jennie's slides towards the beginning is she talked about the free medical clinic being a medical home for their patients. And it is the idea of creating things that are like home, relationships that are like home. It feels like right now the best thing we can do is establish those relationships and like refresh them as much as we can. Because there's going to be so many periods of anxiety where folks really need actionable information. And what we tell them today might not help them when they need it. But if we can create spaces and relationships that allow folks, and we are those folks too, that allow us to know there are places we can call and that we can trust when the wind blows awfully cold, and we maintain those relationships as much as we can because we're going to have to use them over and over again, we lose, as lawyers, we lose the satisfaction that we usually get of being the guys who know and like sharing knowledge with people. That feels good, and we can't do that very much right now. But there is real satisfaction from the advocate side of trying to be and maintain those home-like spaces and like maintain home. We have to do housekeeping. We're Iowa City. It's Maryland Robinson. Housekeeping is important. And if we can maintain those types of spaces for each other, it may not be the satisfaction of giving someone an answer. It's not the safety of an answer. But it's something that I hope can be like dynamic and robust in the weeks and months ahead, which is why I get to end this by saying, what you are doing right now is that. Like seeing each other in the room, knowing who Jennie is, knowing who I am, Jennie knowing that she can work with us, me knowing that we've worked with Jennie in the past, and that we can do that again when we need to, because we're going to need to. If you're watching this on streaming, you just have to trust that everyone in the room looks really good. Very nice people. You would love them. But those sort of relationships, that's the sort of service that we're providing now to the extent we can. Okay, questions, I think, if we can. And Jennie, instead of why fear, we could do the questions page. That's nice. But why don't we do this one instead?
Yeah.
We'll just leave that there and see what happens.
Okay, it is question time. So if you have a question and you're here in the room, please raise your hand. If you have a question and you're watching remotely, please put that question in the chat. Thank you.
I have a question for each of you. First, Jennie, I work at Open Heartland, and one of the things that we see is that people are very concerned about child care. Mm-hmm. Is this an issue that comes up at the clinic at all, where people may not come because they don't have child care when they go to the clinic?
That's a really great question, and I wish my staff were here, because sometimes I'll often say, like, I'm back of the house, so I don't always know day to day. But I do know that we often have a joyful chorus of children's voices at the clinic. So people bring their families, and many of us are like, I'll hold the baby if that's helpful. But so I imagine it is, but I can't give you a better answer than that. But that we often have children there. And we, right now in the renovation, everything's crazy, but we even have like a little box of toys and things to try to help with that.
So it's a welcoming place for kids as well.
Oh, absolutely, yeah.
Bram, it must be very difficult now as an attorney when it appears as if the government isn't even following the law. But that's not my question.
So far I'm with you.
Okay. In the categories of immigrant, I didn't quite understand where those who are undocumented fall, because there's refugees, there's asylees, there's asylum seekers. Mm-hmm. But where does the undocumented immigrant fall?
Excellent question. Okay, so there is no definition of undocumented immigrant or unauthorized immigrant. There are pathways to enter the United States that are established by statute. There are basically three pathways to enter the United States lawfully to stay here permanently. One is through employment, one is through family relationships, one is through humanitarian aid, asylum, refugee status, things like that. There's a small fourth one called a diversity visa for folks who, it's not to diversify the United States, it is to diversify the flow of immigrants into the United States. So if you are from a country that does not send very many people to the United States, you might get this special diversity visa, but it's very small. So there's 3 basic pathways to come permanently. There are lots of pathways to come temporarily: tourist, student, religious worker, scholar, all kinds of ways, temporary worker. If you enter the United States without doing any of those things, so you cross the border, you do not follow any of those pathways, and you have no other basis for status among the 33, 35 that are set out, that's one way to be undocumented. The other way to be undocumented is you do come in through one of those ways, and then you do something that drops you out of status. So you are here on a student visa, and you drop out of school. And part of the rule of your visa is this is only good while you're in school, and now you're not in school. Or you're on a visa that only lasts for a few years, and you stay beyond that. You are what's called a visa overstay. Most estimates of communities who are undocumented, it's about 2/3 visa overstays, about 1/3 folks who enter what's called EWI, entry without inspection. Tough to say. Folks who are undocumented don't usually like to respond to surveys. I don't know why not. Okay, so of the universe of people who either entered without lawful status or entered with lawful status and then fell out of it in some way, in that universe, those folks might be undocumented. But even in that universe of people, there will be folks who nevertheless can't be returned to their home country because as soon as you interview them, you find out they're eligible for asylum. And so as soon as they're in front of a hearing officer, they may have started as undocumented, but what's going to happen at the end of that process is they're an asylee. Or folks who, there are all sorts of different little pathways that can lead to something called non-LPR cancellation of removal, complicated legal status. You're undocumented, you get arrested, they try and deport you, you meet this criteria, and the immigration judge says, I know the government wants me to deport you, but based on your situation, you get a green card. Congratulations, you get to stay here for the rest of your life. Lots and lots of folks in that category. And when you are here undocumented, if stuff happens to you, you are the victim of a crime, and you talk to law enforcement, now you're eligible for a U visa. You can start as undocumented and then become eligible affirmatively on your own accord for all sorts of lawful status. So undocumented is sort of like where someone is at one point in their life. You don't necessarily start that way when you come to the United States. You can come in documented and lose your status. You don't necessarily stay that way for a lot of your life. Things can happen in your life that give you status again. So undocumented isn't so much a way of existing, a status, as much as if none of the various ways apply to you, for the period of your life when you are physically here and none of those ways apply to you, then you are undocumented. But it can change both on the front end and the back end. I feel confident in saying that, although I don't know if that has cleared it up at all. But the big idea is the fact that you see that and don't see undocumented in there means that you get it. And folks who think that like undocumented is a thing, it must be a clear step, that is a misunderstanding of how the system works, which makes our political conversation about immigration law and like all folks who are, these folks who are undocumented, illegal aliens, a gross misunderstanding of how immigration status works.
And can I jump? Would you agree that the shift to the use of the language of like without legal status clears up a lot of that?
Yeah, that's right. I mean, there's, in younger and more innocent times, we talked a lot about what the proper terminology is, and now we talk about, please don't let the people in the black mask kidnap you off the street.
Yeah.
And I have to say, I prefer the old conversations.
Yeah.
But that's right, like trying to get terminology away from illegal or even undocumented was progress, because
Yeah.
the concept was like, do you have a document right now? No, you don't. It became such a code word that just
Yeah.
like the phrase skips the, like, we're talking about whether someone has a document in the moment. But yeah, unauthorized status, people without status, the legal term of like entry without inspection is talking about like the manner you entered the country, not who you are right now. And those are much more precise. Yeah.
Hi,
Hi, Maza.
how are you?
Good.
I just have a question about, the recent, the termination of the Cuban and Haiti and Venezuelan and Nicaraguans visa. And those people already, because we are working with some of those members in our organization, they are so happy that they just apply for work permit. They came in January, and now I think we just got confused. Can you just talk a little bit about what that means for them? Mm-hmm. And is this really going to be ended on April 21st? Mm-hmm. And what's their best path now?
Jenny, why don't you take this one?
Yeah.
Okay, so the CHNV, let me see if I remember the groups. I think it's Cubans, Haitians, Nicaraguans, and Venezuelans, if I remember right. Okay, it is, I can talk about that specifically, but it's also a good illustration of sort of a broader principle of what's going on right now. Okay, so late in the Biden administration, there is an announcement that folks in certain areas, these 4 countries, things are very bad there right now, and we're going to, often, like traditionally, there are pressure valves in immigration law where if something is bad in a home country, we can create a way to allow people who are in the United States to stay here rather than be forced to return to those home countries. Temporary protected status, asylum is the biggie. What the Biden administration did in its waning hours was create a program that said if you're from these 4 countries right now, things are so bad right now, not only do you not have to return if you are in the United States, but we will parole people to enter from those countries into the United States now. You couldn't come in otherwise, but now like you can come in. It's a parole, which means it's like a special temporary permission. Doesn't mean you can stay forever, but it's like let's get folks out of these countries before they are killed in their home countries. Let's go, let's get people in. One of the last acts of the Biden administration. One of the first things the Trump administration does is says, well, no more folks coming from those countries, and cuts it off. Okay, he can do that. The more controversial thing he tried to do is then said, and for the people who arrived that way, who are now here in the United States with that status, I'm cutting off your program too. You now have to leave or we'll deport you. I have your address. You had to give me your address when you came here. I'm keeping track of where you are. You're going to be ordered removed and we're going to come and arrest you and deport you from the country. Hasn't happened yet. Set an effective date of late April. Lawsuits are pending. Will people actually have, like, will they lose their status at the end of April? We'll see what the courts say. I would guess no, but my guess is really not something you want to build a life around. If folks lose their status, will they be picked up and deported en masse? Almost certainly not. There are no immigration officers to spare right now. Folks are awfully busy. And so the idea that they would stop trying to stop people at the border or pick up criminals from jail or things like that and switch instead to Haitians living at home, unlikely. Is it possible they might pick up a few to put it on the news and then everyone is afraid it might be them? Maybe. These are a lot of maybes. That's what it's like for lots of different kinds of status right now, where there is an announcement, you came here on this one kind of status, we are going to get rid of it in the future, terrible things are going to happen to you, get ready. And it is not clear if the administration itself will go through with it, if it tries to, if it will be enjoined by a court, if it is not enjoined by a court, if they will actually be able to effectuate what they might get rid of people's status, but that doesn't mean you've put them on a plane, right? Like someone's got to put them on a plane. Maybe someone's like, yeah, okay, I've lost my status in the United States. That's enough. I should go back to Haiti. Like I fled for my life, but if the news says this card is expired, I should return to that. Maybe some folks will do that, but actually effectuating this, very unclear. And so at any step of this process, including most importantly at the end, what you are looking at is an expansion of the seeker situation, of folks just not knowing. And that means every single service provider working with them not knowing. And it's not just folks who have the CHNV parole entry, it's all kinds of programs. There was an announcement that asylum recipients who have permanent lawful status will not be able to get green cards because they're pausing that vetting. All kinds of paroles being canceled, the lawsuits over DACA, lots and lots of different ways where there's a lot of uncertainty both for the individual, whether it's CHNV or another kind of entry status, uncertainty for them and then uncertainty for everybody who's working with them. Even Ukraine, that's right. Yeah, Ukraine, yeah, right. Yeah, Unity for Ukraine is another program that's going through the same thing. Afghan special immigrant visa holders, which are mostly Afghans who worked with the U.S. military during the war in Afghanistan and then fled for their lives and were evacuated by American forces. We're on the path to status, and they're talking about getting, stopping those.
And then in the meantime, they can't access any public services or et cetera, et cetera. Yeah.
And for two reasons. One is like they might become ineligible to access public services, and another is it's not clear if they're eligible or not. Yeah. And so it's hard to figure out what to do at the service provision level.
Yeah. My next question is kind of common, not question. I really like the way that you said the best thing we can do now is to do things that to make this place for people feel like home. And I will encourage everyone in the room to take that advice tonight and try to make Johnson County a home for immigrants, feel like home for immigrants. If you don't know how, reach out to me at Immigrant Welcome Network of Johnson County. I will show you how. And, we have two Cuban, from two people from Cuba. Yeah, they met here, and they decided to get married. So we have a little party for them at Respect, and so this Sunday at 6 o'clock, right? So 3 o'clock. So please, you can come and say congratulations to them.
Where is that?
That's one at Respect, which is Resilient and Sustainable Future for Iowa City.
Great.
So we're gonna have a small party. They don't know nobody here, so they were our client, and we decided to do a party for them. Everybody are invited. Thank you.
That's great.
That's great.
I had a follow-up question, again with the Cuban. He's waiting forever for his employment authorization. We've had to raise money to cover accommodation for him twice. We don't want to do it a third time. I mean, people have been phenomenally generous, but he wants to work, and he's a good person. Anyway, sorry, do you know if this is normal, kind of, now?
I can show you, we can hang out after and I can show you how to look up on the USCIS website what normal processing times are. They are shockingly long. If someone is entitled to a benefit like that and their application has been pending even longer than the shockingly long times that are normal, there's also a way to like file a complaint online, not always very effective. You can also call a constituent service office for a congressperson or a senator and ask them to like rattle the cage, what's taking so long? Those aren't necessarily effective, but it's something that you can try to do. But the main thing I want to do is validate your concern, which is the waits are shockingly long and they are getting longer. And the current administration has done a better job. They're having a hard time reducing the numbers of folks crossing over the border, which is something they said they were going to do because the numbers were already very low at the end of the Biden administration. They're having a hard time removing folks from the interior of the United States who they think should not be here. The number of removals are not that different from the end of the Biden administration. They're very successful at delaying benefits to lawful immigrants. There's been a lot of regress, when it comes to how long folks are waiting for things they are lawfully entitled to. That really is slowing down. We're seeing real changes there. And so your concern is well placed. I'm sorry if that's not the answer that you would like or that I would like to give.
And thank you to both of you, and Jenny, thank you for the work that you do. I personally have had to take our clients to Cedar Rapids multiple times because we know there's a very long wait time to your clinic, and they, I'm happy that you're expanding, and I understand that this might redress the problem.
There's an amazing QR code for that.
Yeah, and I do want to say, first of all, I wish my staff were here with me, and really they're the ones doing the work. And thank you to Iowa City and Johnson County who have allotted ARPA funds to us for this capacity building renovation. And so it really is thanks to the city of Iowa City and Johnson County. And that is the goal. We don't like the waiting lists any longer than anyone else. So we're working on it. And that being said, statistically, the need is just tremendous.
Well, we need to bring our evening to a conclusion. I'd like to thank Bram and Jennie for sharing all this important information about immigration. And it's a applause for them again. And I thank all of you who are here in the room, and for those of you who are joining us remotely. Recordings of this program will be posted on the League of Women Voters website, and it will also be on the Iowa City Public Library channel. So if you would like to watch it again, or if you know someone who wasn't able to be here but would like to watch it, please let them know. If you're interested in learning more about our co-sponsors, please stop at the tables in the back, and I'm sure they'll be able to answer your questions. If you want to learn more about the League of Women Voters, go to our website, which is lwvjc.org.